Hi everyone, thank you very much for having me today. My name is Rhys Holmes. I got a rare condition, superficial siderosis, which I was diagnosed with in 2016. I was previously a musician and now I'm completely deaf. So it's totally changed my life. And now I'm sort of advocating for this rare disease to try and find new treatments in collaboration with various nations across the world, predominantly the United States of America and Australia. We're sort of all collaborating to improve things. So I'm going to just tell my story now of how this condition manifested and go on to my experience with taking a repurposed drug. Okay, so here's me when I was 8 years old. I had a brain tumor removed from the back of my head. It was benign, so it wasn't cancerous. And after that, all seemed well and good. I had the typical symptoms of a brain tumor, which was vomiting, lethargy, fatigue, that sort of thing, headaches. And after it was removed, a day later, I was back in hospital with meningitis again. There's an infection at the back of my head. Back in school then, as soon as I started high school even, I developed hydrocephalus, very similar symptoms to the brain tumor. So I was back in hospital and I had to have a VP shunt inserted, which is a drain that drains the excess spinal fluid from the head into the cavity in the stomach. That blocked a few times. So every time it blocked, I developed these same symptoms again, which was very similar again to the brain tumor, lethargy, vomiting, headaches, and that sort of thing. And I was fine then until about 2009. After I had a shunt revision in 2002, they put an extra bit and all seemed well and good. 2009, then I developed meningitis whilst I was studying at university. Music as a musician, as you can see. So the meningitis symptoms were, again, very similar to everything I had before. So that was worry for my parents. I can remember being at my girlfriend's house at the time, and I had vomiting, and her dad running over to me with a saucepan of all things, which was very different. So that was the diagnosis of meningitis. And a few years later, after the meningitis, which I'd had sort of antibiotics for and cleared, I developed bilateral minor hearing loss both sides and tinnitus, which is a high pitch. And they'd always said to me that was the meningitis that caused that. My hearing was stable then up until 2015. I was still playing as a musician. I had a sudden night drop in my right ear. I woke up almost completely deaf in my right ear at the time. And you can see there the drop on my audiogram. So just sudden whoosh. Seeing my audiologist, he was very concerned. He referred me straight away. And then whilst I was in hospital, then getting this investigated, my shunt blocked, which I hadn't done since 2002. So straight away, I was thinking something must be wrong, and I didn't know what it was. So I was discharged then after the shunt revision. You can see there, but parts of the shunt were revised. I started to get unsteady on my feet. I had double vision looking left. I was catching a bus to work because I couldn't drive because I had brain surgery. And then I started to get headaches and shaking in my lower limbs. I was actually at a day out I worked for an insurance company as a data analyst. I was at a day out at archery, but holding the bow back, my legs were shaking like they are now a bit. And the instructor jumped on me. So that was another concern of mine. At the time, I just shrugged it off as some old man came over to me and gave me a bar of chocolate, thinking it was my blood sugar, but maybe not. And then the fatigue started as well. So my diagnosis for this, what was going on, it was very sort of scary for me because I knew something was wrong, but no one sort of gave me any answers. There's multiple A&E visits. I saw 3 different neurologists, a neurosurgeon who I was under because I had the shunt revised, a rheumatologist because they were concerned it was sort of a blood disorder that was causing my hearing loss. I saw 2 ENT specialists, one of which was sort of thoroughly referring me to everyone he could to try and find out why my hearing had suddenly gone. An audiologist, it had 5 CT scans, and eventually then when I developed the double vision, this second neurologist wrote to the third neurologist, who's now my current neurologist, and he decided he was going to do lumbar punctures, and that's when it all started to become apparent that something was severely wrong. Remember the junior doctor holding up the sample of spinal fluid, and he said to me, "Is it always this colour?" Because I've had a yellow tinge to it. Obviously, I was clueless at the time. This was all new to me. Then I eventually had an MRI scan. This is the exact one from 2016 when it's happened, which shows superficial siderosis, and you can see there the iron deposits, which is the dark colour. So it was caused by chronic or intermittent bleeding into the cerebrospinal fluid, so it takes years to develop. It overwhelms the body's capabilities to remove the full blood product, and then you've got this toxic iron sort of in the cerebrospinal fluid that's flowing around. So it can take many years to develop, usually decades. And then it causes various damage depending on where the iron settles. Hearing is a common symptom because of the spinal fluids, the nerves sitting in the spinal fluid, so that's sort of exposed to the toxic iron. Ataxia, so problems with balance and gait. And loss of smell, again, is one of the most common symptoms, reported symptoms, and it's a progressive disease. So as long as the iron remains in the central nervous system, it's continuing to cause damage. So the causes of it are tear in the dura, which is the membrane that surrounds the brain and the spine. Previous neurosurgery is one of the most common causes. Trauma to the head or spine, so people have had sort of accidents, pseudomeningocele, which I also had from the removal of the brain tumor, but obviously long-standing pseudomeningocele, which is with CSF, cerebrospinal fluid, sort of outside the dura. Tumors, if they're there sort of over a long period of time, causing intracranial bleed and aneurysms. And of course, for me, was that brain tumor removal when I was 8 years old. So I was walking around with this, bleed in the back of my head without knowing until the symptoms sort of developed. So I'd seen my neurologist. After the diagnosis, I was sort of relieved. I sort of, oh, finally, I've got this sort of diagnosis. But and then he said to me, "You're the first case I've ever seen." So I was the first case he'd seen in Wales at the time. But he'd known a doctor, thankfully, that sort of knew about the condition. So he said to me first, he's going to look for this, what's causing the bleeding, and sort of speak to my neurosurgeons, speak to his colleagues in London, and he told me to look on social media. And that's where I came across deferoprone, which is a brand name Ferroprox on there, which is now a patent's up, so it's a generic version as well. Which is an iron chelating agent that can remove this toxic iron from the central nervous system. And it's the only drug of its kind that can actually cross through the blood-brain barrier. So it's, for me, it was a massive sort of sense of hope. There was sort of nowhere to go, no sort of research going on. And thought, oh, this drug is gonna, and the surgeon at the time, he was adamant that he wanted me to start this drug before he even attempted the surgery, or if he could do it. So I found that there was no cure for this disease, and most of the symptoms are sort of life-changing and permanent. Then the surgeon said to me, "It's too dangerous for him to operate." He told me the back of my head would cave in. So I was worried. Then I got this bleed and nothing's happening, and that was a massive downer for me. So then deferoprone is the only treatment. The surgeon said to me, "Get this drug." He wouldn't attempt the surgery. He said he would, but he said he'd probably kill me. So I was a bit reluctant to do that. And it's off-label for superficial siderosis. My neurologist was unable to prescribe the drug. So I was, lost. So then I had to go to the NHS Wales funding panel and present the case. I obtained political support. My neurologist also had to present his own case of why I should get this drug. And I sort of gathered supporting evidence, and the only evidence that this drug actually worked, or supposedly worked, was there was a high-profile neurologist based at Harvard University, and he was at Johns Hopkins previously, and he'd done a small observational study. So I used that to present to the NHS Wales funding panel with my, AM support, even, or whatever they call it at the time. But I might have to pay for a private prescription to start this drug as soon as possible, because I was worried that this iron is going to keep overwhelming and causing further damage and like sort of anxiety things because you don't know what's going to happen. And the problem with that then was I had to have regular blood tests because it can lower your neutrophil count and sort of the dangerous levels and cause neutropenia. And unfortunately, some patients do suffer with that and aren't able to take this drug, but most of the patients on it are stable. So it's had some sort of positive effect. But there's a problem when I started this drug, and it's a bit of a rocky start. I had the shunt started blocking again. I had the shunt at the time, and I can't remember how many times it blocked. It was been a good 5 or 6 at least. So I was back and forth having lots of brain surgery. I am there. So then I was unable to work, and then I was paying privately for the drug. So luckily my parents sort of chipped in as well, but I was sort of worried then about paying for it because I was having so much surgery and out of work. And my neurologist then miraculously said he'd managed to, get the drug off label so we could use it, so I could prescribe it. Whilst I was in the shunt revisions, I met a neurosurgeon. Absolutely fantastic guy. I can't speak highly of enough, but he's probably fed on me singing his praises. He sealed the back of my head then, a PEEK implant, which is sort of a polyether ketone, so medical grade plastic. He did a whole presentation on it at one of the neurosurgery shows. He removed my shunt then, carried out an ETV, endoscopic third ventriculostomy, with a sort of poke a hole in the third ventricle so the cerebral spinal fluid drains when the pressure gets too high. So I had some stability. There was sort of no more neurosurgery then, and so no more blood infiltration into my cerebral spinal fluid. So for me, that was a massive positive thing, because I now no longer had this bleed going on, which was sort of introducing toxic iron into my system. So at 2020 to present, I had a lumbar puncture then, which was completely clear, which I was surprised to let me grab it, hold a bottle of cerebral spinal fluid, but there we go. That's the first time I actually seen it clear. So I was sort of over the moon about that, because every time I seen it, it was sort of yellowy or, full of blood. Ferritin levels in my CSF were much lower. Now, 2 things that can indicate to me was it could have been the surgery stopping the bleed, which is more than likely because it's no introducing, but I also think I'm taking the deferriprone. Now, the thing that indicates to me that deferriprone is working is that the hemosiderin, which is the iron and protein product that sticks to the brain and spine, you can see on the MRI scan, that was slightly removed. Now, that wouldn't remove purely from closing the bleed because my sort of central nervous system's overwhelmed. So that, I think, to me, that's a massive indicator that the drug actually works. And also I've seen scans of my friends in Australia and in the States as well, with their sort of reduction in hemosiderin. It's very, very vast reduction on some of the people. You can see it's gone from to next to nothing now. So I think, to me, it clearly works. But it's a strict regime with it because it can cause the neutropenia, and because you want to take this drug to stop the iron. You want to take it at a time so that it doesn't bind to iron in your stomach. It's got to go through your stomach and your blood before it gets to the central nervous system. Which goes back to something that Rosie said earlier about repurposing drugs for new methods of administration, sort of nasal sprays, which is something we're looking into at the moment. And as far as quality of life goes, I noticed near enough instantly after taking deferriprone, or a few weeks, months maybe, that I could taste again and I could smell again, which I couldn't before. My sense of smell is not perfect, but it's 100 times better than what it was. And so that's a massive improvement in quality of life for me, which just made a big difference. Overall, it can take many years to remove the hemosiderin. I'm currently working with the Superficial Siderosis Research Alliance, sort of a multinational approach for awareness, funding, and research. And we're doing a double-blind trial, which is currently taking place between the UK and the US, with Professor David Waring, based at University College London. He's involved. We've encountered lots of barriers, such as limited patient pool. And then you've got different regulations in sort of, and then you've obviously got some patients that are already taking the drug as well. So that was another big issue. So, and then we're looking to establish it over here as well, so we can sort of collaborate better. And the biggest thing at the moment is sort of lots of red tape and regulation. Let's say we've got the problems with what I've just described then, and you've got obviously some patients can't tolerate. We do think it's an allergy to the drug. But say there's been small studies in Japan, and there's been the observational study in the States. And when I was first diagnosed, and I got the deferriprone, one of my first things, my uncle, as a paramedic, he said to me, wouldn't it be good if they could just inject it straight into your spinal fluid? I thought, well, you avoid the stomach and the blood then, so you go straight to the iron on your brain and spine. But obviously the problem with that is a potent drug. I put it to my neurologist, he said, I wouldn't want to do that. So I don't think anyone's going to be a guinea pig for that. So then after discussing this trial with people in the States, there's a lady, Rory, she's executive director of the Alliance in the States, and she's actually principal investigator for the double-blind trial we're looking to do at the moment. One of the things that's come out of it is sort of a nasal spray. But obviously, when I emailed the manufacturer of the drug at the time when it was patented, which was Apopharma, I believe. Yeah, and they said to me they need more research before they can sort of get involved in that. But then they directed me straight back to Dr. Michael Levy, who I was in touch with anyway. So that's when we got sort of collaborated between London and the States to get this clinical trial underway. So there's a lot of back and forth, and I was getting nowhere. But now we've sort of got this trial written up, and it seems to be people taking interest. And I speak to a lot of the community because siderosis community, because it's quite rare. And I think everyone's there's a lot of loss of hope because there's sort of no treatment, no cure. I think, speaking to the majority of people, they want to do this stuff to happen, so they've got this treatments available to them. I think that's the biggest downfall, is people are losing hope that there's no treatment. So stuff like this, I think people are more than willing to get involved with to push things forward to, develop new treatments. Sorry, go there. Sorry, finished a bit early.